Hello and welcome back to the show. And as you can tell, we have changed guests because we are talking about something very important. We have two doctors here, right here from local places, and they're going to talk to us about something that's happening right here with me, with you, with a lot of people. We're going to first start with Dr. Tracie, and we're going to start talking about asthma. Now, there are a lot of young children out there with asthma, and one of the things I'm going to ask Dr. Tracie is just what is asthma, and we're going to go from there. So Dr. Tracie, what is asthma?
So asthma is a restriction of the airways. So in our lungs, we have almost like small little circles of airways, and so they can be restricted with different things. When you're talking about an older population, or you're talking about COPD, it's sometimes because of things we're doing to ourselves, because of smoking, and that's not reversible. Those are things that you'll have to take medicines for a long time. You can't really reverse it. It can get worse, but it may not get better. With asthma, there are medications that open the airways back up, and there are things that can actually stimulate it to get worse, like smoke, or to get better, which are going to be the inhalers that people will use. You can also have something called exercise-induced asthma, and that's not that the weather or that smoke exposure or things like that will set off your wheezing or your chest pain or different symptoms. It's more that when you start working out or running, and people that are in athletics, kids that are in athletics, they'll get those same symptoms, and their airways need to be opened up.
Okay, so we talked about asthma, but we're coming back to that.
Okay.
Dr. Sinha.
Yes.
Oh, good. I said it right. COPD. Dr. Tracie mentioned it. COPD is for grown-ups. So tell us, just what is COPD?
So COPD is an acronym or a term that stands for chronic obstructive pulmonary disease. So under that umbrella of COPD, there's different kinds of conditions. One is chronic bronchitis, one is emphysema, and then there's others, bronchiolitis, bronchiectasis. But the common ones are really chronic bronchitis and emphysema. And the important thing about it is that sometimes asthma can progress into COPD. So instead of getting that reversibility that doctor mentioned, where you take the medication and it opens the airway becomes fixed over time so that it doesn't respond as well to the therapies anymore. The neat thing about COPD is it's considered a preventable disease. So most of the time, it's something environmental that we do that causes COPD to occur. So the common thing would be cigarette smoke. Pollution is another big one.
But cigarette smoke.
That's the big one. Yeah.
Wow.
Yes, ma'am.
So you're telling all those people in our viewing audience that are still puffing that they need to quit puffing.
Well, that is what I'm trying to say. So the problem is that cigarette smoking is still quite common.
Yes.
So if you look at it nationwide in the United States, about 16% of the population is still smoking. If you look at California, it's a little bit less, probably about 11%. Utah is only about 7%.
Really?
And guess who takes the cake for the highest rates of smoking in the whole country?
Texas?
Arklatex, yeah.
Wow. Oh, all of us around here.
Yeah, we all get to be included in that high rate, which is close to 30% in our area of people smoke. Some of the pockets in smaller towns, up to 60 or 70% of folks are still smoking.
Really?
Yeah. So I'm on a campaign to change that and get those rates way down.
Yeah. Oh my goodness.
Yes, ma'am.
I don't know why I thought everybody had stopped, although every now and then I do hear someone come in and tell me that, oh yeah, I tried to get my husband to stop. In fact, I know someone personally who says, I tried to get my husband to stop. The doctors have told him to stop. He just won't stop. So what we're telling people is they got to put that cigarette down.
They do, and it's easier said than done, unfortunately.
Of course.
Yeah. It's an addictive thing, not only from a chemical dependence, but from a psychological dependence as well, that once you get into that habit, and then there's other folks around you that are smoking as well, it's very hard to change those habits that have been there for a long time.
So we have to change friends. I mean, I don't know what else to say. We got to get rid of those friends that smoke and get us some non-smoking friends. I guess that'll help.
Or get your friends not to smoke too.
Okay. Well, maybe we leave them. They won't smoke no more.
Yeah.
So, so Dr. Tracie, we'll come back to you. So now we talked about what is asthma. And so then we've got risk factors for asthma. So what are some risk factors? I know low birth weight is one, but
Right.
Oh, yeah.
So of course our premature infants that are born early will have a higher risk of getting any kind of lung disease. Premature babies have a higher risk for many things. But we also look, just like with anything, with race. We look at African Americans being high, Hispanics. You mentioned earlier Puerto Ricans being high on the list of having a higher risk factor. Environmental causes. People that are exposed to smoke, children that are exposed to smoke are at a higher risk factor for things like chronic lung disease, wheezing, and especially when they're exposed early, when they're babies. We tell every appointment, we say, don't expose your kids to smoke. And that's more than just lung disease and asthma. That's a risk factor for many things.
Wow.
But those are some of the risk factors for, of course, family history. Also, if there's a family history of severe asthma, then sometimes that's just a genetic thing also.
Wow. Well, I guess now, Dr. Sinha, because something you said, she started out talking about asthma, and then I thought, now I could be wrong, I thought I heard you say that asthma starting out, say, I'm going to just use my brother, I hope he's not listening, but my brother started out as a baby with asthma, and then he didn't outgrow it. So that's when it goes into COPD?
It very well can go into COPD. And so the idea would be that you want to do everything you can early on to make sure that your asthma is well controlled. So as doctors pointing out, if you can prevent yourself from getting exposed to things that can make the asthma worse over time, and if you can take the treatment that doctor's providing for you, then you'll prevent yourself from progressing down that pathway or that slope of worsening lung function.
Oh, wow.
Yeah.
Gee. Oh, wow. Just can't. Well, I got another question. Bronchitis. So you talked about bronchitis. Now, I've had bronchitis before. The doctor said I had bronchitis. I didn't believe it. But anyway, the doctor said I had it. The doctor gave me some medicine and it went away. So what you're talking about is something that's just not going to go away. Is that right?
That's correct. So
Okay.
probably what you had was something called acute bronchitis.
Ah.
So if you get, for example, a virus or some postnasal drip,
Okay.
or maybe some exposure to even smoke at a barbecue or something, you can get acute bronchitis that doesn't last very long. Chronic bronchitis, on the other hand, is by definition something that lasts for 3 months for the year, for 2 consecutive years in a row. So it's something that's much more long lasting. And that's the one that goes under that subheading of COPD.
Oh, okay. So I don't want that.
No, ma'am.
I don't want that. So now, Dr. Tracie, I'm coming back to you.
Okay.
Because one of the things, in doing my little research, that I found out was that we seem to have more and more children being born and they're having asthma. So why is that?
So one thing, like we mentioned earlier, prematurity.
Okay.
And so now we have the medical knowledge to be able to have babies earlier and they live.
Mm-hmm.
So we also have to know that when we have babies that live, that were born at 27, 28 weeks, 29 weeks, they're going to have sometimes, not all the time, I've seen some that are rocking and rolling with no medications, but sometimes they will need an inhaler, a daily inhaler. Sometimes they will have asthma or what we call chronic lung disease in children's because of how immature their lungs were when they were born. And so, of course, if you see babies born earlier and actually living, then you're going to see a few other things that are happening. Along with that, I mention it all the time with you, weight can play a factor. Yes. Weight and habits can play a factor also in asthma-like symptoms. And so we'll say, hey, we'll give you a test called, when you're old enough to be able to do it, where you'll breathe into a machine and it's called pulmonary function test. And we'll be able to say whether you have asthma or whether you do not. If your lung function is not where it's supposed to be, then we'll call that asthma. Sometimes just because of a lot of weight, you're not even able to do that. And so we have symptoms where you have a kid that's obese or overweight that's running and playing that can't keep up with the other kids. They get tight chest, they start coughing, those things. And so we give them an inhaler to help with that. And so they have asthma-like symptoms or asthma, and it was more brought on because of the weight. So there are several things. Also, he mentioned smoke exposure. We have a decreased amount of smoking, but there's still a high amount of people that are smoking. And so when you're in an environment where you're exposed to smoke, then you're going to have kids that are having these symptoms, and so you'll see that more also. And so
Wow.
On that note, I'll point out one more thing, that the rate of smoking in this country is declining. Very gradually it's going down. But what we're seeing in young people is another rise. And the reason for that is the use of the e-cigarettes. So for a while they were not regulated by the FDA until within the past year. So even kids could get the e-cigarettes with bubblegum flavors and things. And then it was creating this dependence on nicotine and this dependence on the behavioral aspect of smoking, and they were transitioning to cigarettes very early. So still the top 3 problems here are smoking, and we want to address those first and foremost, since it is a preventable condition on the COPD side.
It is. And I'm glad you mentioned that about the e-cigarettes, because when they first came out, I don't think I realized that there was some nicotine in the e-cigarettes.
Yes.
So that's terrible, because I thought the e-cigarettes were supposed to be for people who wanted to stop smoking. Well, how can you stop smoking if I'm still giving you nicotine? I mean, I'm not a physician, so I'm just trying to figure that out.
They were trying to cut the doses a little bit, but the doses in the e-cigarettes were not regulated. So you never really knew how much nicotine you were getting.
That's terrible.
Yes.
Bubblegum and nicotine at the same time.
Yeah.
It's not a good recipe at all. So so the fact that the e-cigarettes are now regulated, then we are hoping that the nicotine is also regulated.
Yes, especially in that younger group.
Because we need that.
Mhm.
Because we don't want to have young people starting something that we're trying to tell everybody else to stop.
I agree.
It didn't make that well, but so we've got about a minute. So we're going to, in this first segment, we're going to take a break. We're going to come back, and then we're going to continue our talk, because I've got some more questions about asthma and about COPD that we want our viewing audience to know. Because so far we've given them, a wealth of information. One thing, stop smoking, and I think stop eating, something like that, so that we won't have asthma or COPD. So just sit tight. We'll be right back.
Thank you.
We will be right back after this break.